All right. First of all, I just wanted to say thank you, Don, for participating in this. This is a new series that we're starting that we wanted to ask people who are authorities in certain areas about their area. We got Don Hayduk here from the health department, and he's going to answer some questions about the COVID vaccine that we have coming up, and I think a couple of questions about COVID in general. So the first question is, what is the order that they are planning for who qualifies? Direct care workers and first responders, teacher over 65, and then what?
Well, just to start off with, I really appreciate this opportunity to get the information out to our community. Now, we have been working in a collaborative effort with our partners, Henry Ford Allegiance Hospital, Center for Family Health, various pharmacies, as well as the municipal governments, townships, villages, as well as the city and county. What we do is we are actually using the prioritization matrix that the state uses and pushes out to all the local health departments, which is derived from the federal CDC matrix and their experts. They have essentially looked at the population groups across the nation, and then within the state of Michigan for Michigan Department of Health and Human Services, and looked at the numbers and looked at the prioritization matrix, and they've come up with a plan that essentially breaks it out into 4 phases, and then there are various subgroups within those phases. The 4 phases are named 1A, 1B, 1C, and phase 2, which is the final phase. Right now, we are actually currently vaccinating the second half of the phase 1A groups. And the phase 1A groups include EMS, EMTs, the high-risk frontline hospital workers in the emergency rooms, those caring for the COVID patients. We're also looking at other healthcare workers in that group that have direct patient care. And then another key group within the phase 1A are the staff and residents of long-term care facilities. And the pharmacies, the pharmacy chains of CVS and Walgreens, they have a federal contract, and we've been working with them as well. And they're the ones doing the long-term care facility residents and staff, and they're currently vaccinating them. And when I said we're really basically halfway through that group, the reason I can say that is the current vaccines that are approved for use are a 2-dose vaccine. So it requires 2 doses to get full efficacy for the vaccine and ramp up your immunity to the virus. So we're pretty much all the way through most of those first doses, which now in about 3-4 weeks, 2 weeks, we're just starting the second doses for some of these folks. And this is, like I mentioned before, a collaborative effort with Henry Ford Hospital and Center for Family Health and the pharmacies. Now that's phase 1A. We're also just starting some of the groups in phase 1B. And there are a lot of groups in phase 1B. And these are essentially your over 65 of age senior citizens, your educators, K through 12, pre-K as well, child care staff. We also have other first responders, police, fire, and the corrections staff in our jails and prisons, and then other key critical infrastructure workers over and above what I just mentioned, such as consumer energy folks who are working on our energy grid, our electrical grid, and other energy workers, water supply and wastewater systems. Those are the critical infrastructures that we're kind of targeting right now. Now, those type of people, those workers, we have not actually started, but they're just around the corner, so to speak, with their first doses. And to continue on with this, the 1C group, which we have not started at all yet, those are the ages 16 to 64 that have some pre-existing COVID-related underlying medical conditions. We have yet to start those folks. And then there are some remaining essential workers that have not started as well. So all over, it is a step-by-step process that is based upon priorities, because we have to prioritize. There just isn't enough vaccine yet. This is a worldwide pandemic. COVID exists worldwide. There are many manufacturers that are getting approved out there worldwide, and there's just not enough vaccine coming into the state of Michigan to be able to vaccinate everybody at the same time. And so that's why we have to prioritize.
Thank you so much for such a thorough answer.